A new Department of Justice report, I should say, found children who need behavioral health services in our state are facing discrimination and unnecessary segregation. Thank you for joining us at 4. I'm Kirsten Joyce.
And I'm Christian Costa. That is not enough of these services are here, according to the report. Parents are then forced to admit their children into institutional settings like hospitals and residential treatment facilities states away.
It's a violation of the Americans with Disability Act. Reporter Ryan Matthew joins us live now in studio with the strain the situation places on families here in the Valley. Ryan.
Yeah, Kirsten, Christian, you want to take a look at this map right here. It's part of the most recent Mental Health America report. Nevada, you can see in the dark blue. Our state ranks 5th for children who have at least one major depressive episode each year. And this next map, it keeps Nevada in the dark blue, as you can see. We're nearly 5% more than the national average for youth with depression who did not receive mental health treatment. It's an ongoing problem that this federal report shines light on. 17-year-old Jesse Simpson is not like most kids.
My son would kill the crap out of me.
He was born with cerebral palsy and autism at just 25 weeks. That's on top of significant anxiety and PTSD, all provoking years worth of constant medical treatment.
That's what he's known his childhood is pain.
His mother, Crystal Simpson, says first diagnosing mental disabilities took a year. The wait list to get other necessary behavioral services took just as long, she says, and she was left with a choice: admit him to a medical institution in Utah, potentially for months at a time, or drive him there multiple times a year herself. She chose the latter.
Why should we segregate them off and treat them like it was back in the 40s?
The Department of Justice report finding hundreds of Nevada families facing this dilemma. It says the state does not have an adequate amount of community-based services that could keep them here at home. A quarter of these children staying away for over a year.
As parents, we have choices, but in Nevada, we've had less choices.
Char Frost is the statewide family network director for Nevada PEP, a resource to help families navigate their children's mental disabilities. A lack of local behavioral services forced her to submit her own 12-year-old child to an out-of-state institution years ago. Now, she and other officials expecting change in Nevada's youth mental health system.
When kids are at home and they're doing well mentally, they do better at school. They do better with relationships with others. You know, there's just a whole lot of benefits that come along with being at home versus being put into a hospital.
There needs to be more doctors that can do this stuff, and there's not.
Now, we don't know specifically how many children that the state require, or in the state rather, that require these services and could be benefiting for them to be closer to home. But for Nevada PEP here in Las Vegas alone, they say they've served over 19,000 people in just 2021. Reporting live in studio, Ryan Matthew, 8 News Now.
Well, Governor Steve Sisolak responded to the DOJ investigation, agreeing that the state is lacking in-home services. Respite, crisis services, and more are just a few mentioned in the report. Now, he did not address how he will specifically address how he will bring more of them to Nevada communities.